guys, welcome to my channel. This is Dr. K and welcome to the Gynae Talks. So today I'm not gonna even waste more time, but I'm going to explain a little further on a topic I had last week. Link is going to be right over here, and it's about the vasectomy. Vasectomy, what happens after vasectomy? And I know so many people want to know this, so make sure you call your friends, and this time call all your male friends, call those guys who have decided I'm done with getting kids. Let them have this topic right here. Okay, so since you've watched that previous video, I know now you know what a vasectomy means, and you will ask yourself, so what next after a vasectomy? So this is now the video for you. You want to know what will happen after your vasectomy. So there are things that you will be instructed by your doctor after the simple procedure. By the way, it's done in the hospital. It's very short, it's cheap, it's not as intrusive as having a woman having her tubes blocked. So that if you've done it before, kudos guys. If you've done it before, kudos. But those ones who are planning to do it, go ahead and do it if you're done with getting your children. So what happens after this? We will give you some information. First, you should know that immediately after a vasectomy, you still have sperm in your tubes. Okay, so after a vasectomy, we still have to tell you, use something, either a condom, or your partner can use another hormone to protect yourselves from getting pregnant again, because the sperm is still there for 3 to 4 months, which is equivalent to 20 ejaculations. You need to ejaculate almost 20 times so that you can be able to clear out all the possible sperms that can get you pregnant together with your partner. So that is very important information for you to know, that it does not work immediately. You can still get a woman pregnant within 3 to 4 months. So we have to confirm this. After 3 to 4 months, we do a test on your semen and check whether you still have sperm in your semen and whether they're active. So we'll repeat it at around 12 weeks or at 16 weeks. Sometimes you do it once or sometimes you do it twice. So if you get sperm in your semen, it does not mean that the doctor did not cut your tubes. They did, but because you still have other tubes that usually pass the other fluid, then it's possible to still have sperm that can work. So 3 to 4 months, you have to use something else, either a condom, or your partner can use any other contraceptive only for that short time until confirmed. Then I had someone asking me a question on whether they are able to ejaculate normal. Yes, you are able to ejaculate normally. It's not air that you're going to produce. Don't worry guys, you're still going to have fluid. So what happens is that what we close is the tube that passes the sperm, but the tube that passes the fluid content is usually ahead of that area where we have cut. So you still have the seminal fluid. The only issue is that you do not have sperm in that seminal fluid. So yes, you'll be able to ejaculate as usual. Someone else will want to find out whether they'll be able to have sexual function as usual. The answer is yes, 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 yes. You should be able to do that. Sometimes if it has affected you psychologically, because for men it's a bit different. You tend to have you have to be psychologically prepared for all this. It might affect in terms of getting an erection. So that is it's usually more of a psychological issue, but not necessarily a hormonal issue, because we have not blocked any hormones. You should be a man still. You will not change your walking style. You will not have hips. You will not have breasts. You will not have clear faces like women. But you'll remain a man. You will still remain a man. Nobody needs to know if you're still uncomfortable to tell other people. But this is a very, very feasible contraceptive. It's important for you to know that it is an option for men who have decided not to father any more children, because the reversal can be done, but it's not as successful. So you should also know, when you're doing a vasectomy, it's one of the ones that we call permanent sterilization. it's similar to the one we do a bilateral tubal ligation, which is closing of the female tubes. So it's similar to that. The only difference is that for the females, it's more intrusive. It's a bigger surgery as compared to having yours done. So please guys, consider the girls and your wives. If your wife cannot undergo any procedure, surgical procedure, because she has any other issue or she's already gone through so much, you might want to take this for her. If your wife is hyperfertile, that's another thing, is that you've tried everything and she's still getting pregnant, she's on a coil and she's still getting pregnant, on hormonal medication, she's still getting pregnant. Consider you're two of you making babies, so make sure that even for you, you can consider a vasectomy. Yes, it's done in Kenya. You can write down there below. You can write if you know questions about vasectomy. If you want to know anything about vasectomy, I'll be sure to answer you. And we also do it as gynecologists or surgeons, so do not be afraid to approach us for that. So this is from Dr. K. Please share, subscribe, write a comment down below. I'll be able to reply to you, and have an amazing time.